Hello and welcome to our live hangout today, called Skin Needling and Platelet-Rich Plasma for Acne Scarring Treatment and Facial Rejuvenation with Dr. Jeffrey Rapaport. My name is Craig Ure and I'll be your host today. Now in today's hangout you're going to learn everything you ever wanted to know about skin needling and PRP, Platelet-Rich Plasma, what it is, who it's for, and whether you'll benefit from this treatment. Good morning, Dr. Rapaport.
Good morning. Great to see you again, Craig.
Good. Now, I've got to ask the first question. What is, I've heard of needling before with the rollers, and we're going to have to look at the difference between them, but this is specifically needling and this platelet-rich plasma. So please explain, what is this new needling and platelet-rich plasma addition?
Okay, first of all, needling was discovered in the late 90s, and needling is a general term that describes two different types of needling. Needling means taking a sharp pin or surgical type pointed device and piercing the skin. Now, there's a lot of different ways to do needling, and you alluded to two of them. One of them is with a roller, where
yes, I've seen those rollers before,
where the individual needles, or if you want to look at them as harpoons, or you want to look at them as surgical instrument with a pointed tip, no matter how you want to describe them, they're on a roller where one person can take the roller and roll it on the skin, and the needle penetrates the skin. The second type of needling is a much more sophisticated needling done with a more surgical-oriented type of handpiece that has an electric engine to it, and it has anywhere from 12 to 16 of these needles in the handpiece, and you can control how fast the needles go up and down in the handpiece. In other words, how fast they're going into the skin and out of the skin, and you can control also the depth that they go. With the rollers, you can buy rollers that have needles at different depths, and we're going to talk about what's safe and what's not safe, and what should be used for certain indications and what are not, I don't think should be used. So the difference lies in the fact as your needles are being moved. I'm hearing a little echo, by the way. Are your needles being moved by electric motor, or is your hand rolling back and forth with the roller?
Right.
And we do use both of the devices for different types of things. The whole purpose and the whole way that the needling, there's a lot of different ways that the needle functions. In terms of skin rejuvenation, what happens is when you penetrate the skin to any certain depth, it creates a wound response, and the body responds by trying to repair itself by producing collagen and elastic fibers, very similar to the way a laser would penetrate the skin and getting the body to repair itself. When you use the rollers that are deeper, you can treat deeper problems. Now, the rollers that are available on Amazon or sometimes in different types of systems.
I've seen them. Those plastic, like a roll on the end with lots of little needles in, and it's a plastic handle, and you often sold with like serums and things.
Yes, 95% of those are produced overseas. There's very few of them that are produced in this country. And the Europeans, especially in England and in Korea, are a little bit ahead of us in terms of the production of these individual instruments. Now, you have to remember when you're talking about a roller, that the roller, there's a lot of different aspects to it. Number one, the actual needle that's on the roller, how big is the needle? How wide is the needle? How long is the needle? And how many of these needles are on the roller? So all of those are important. Naturally, there are some safety tips that I would like to recommend to our listeners in terms of a couple things. Number one, I think that if you use a needle roller that's more than 1/4 of a millimeter, which is, they say 25 millimeters, or 1/4 of, it's 25 millimeters, which would be 1/4 of a centimeter. If you go anything deeper than that, then you start involving the blood supply, because between 25 millimeters and 50 millimeters, if you do needling, you're going to start to see some bleeding. Now, why do I mention that? These needles come out of the box, these rollers come out of the box as sterile, but if you leave them around the house, or you start using this on a regular basis, and you don't either boil them or do something to sterilize them, there is a fairly good chance that you could be infecting yourself if you use a needle that goes more than 25. It's really 0.25 millimeters. So if you're using something more than 0.25 millimeters, then you're getting to the depth where you can get blood, and you have to be careful about what you're doing. Now, I really believe that the home use needles should not be more than the 0.25 millimeter depth. Okay?
Right. Mm-hmm. Makes sense.
The unit that we use in the office, by the way, can go all the way up to 2.5 millimeters. But at home, I don't recommend more than 25. And the Society of Estheticians also says that once you start going to the 50 millimeters, okay, that, or let's say 0.5 millimeters, excuse me, when you get to the 0.5 millimeters, that you have to be very careful that when you go down to the bloody areas that you don't produce scarring and infection. So I think the safe thing for people to use at home is the 0.25 millimeter roller. And the way the 0.25 millimeter roller works is, once again, it's going to stimulate collagen production and growth factors, etc. Now, you can't really expect to see results with one treatment. This is something that has to be done for weeks or months in order to see an adequate response. I want to point out something else. When you use this roller, it creates channels from the epidermis to go down into the dermis. And this is another very, very important factor. So that you can put medications on top of the skin that can penetrate deeper down into the skin, and you can get a better result with your topical cosmeceuticals or topical medications. Mm-hmm. And the most typical thing that people use, some people use hyaluronic acid. The problem with hyaluronic acid is it's nice, but it doesn't really stay as hyaluronic acid when it penetrates the skin. It breaks down because it's not cross-linked. And the other thing that I recommend for people if they're going to do needling and they want rejuvenation is to use retinol, because retinol does a very good job of staying together and also does a good job for rejuvenating. So right. My advice for people who are going to use the rollers at home, do not go more than 0.25 millimeters and use it with retinol for skin rejuvenation. Now, there was just an article in one of the dermatologic journals that talked about using an at-home roller to treat acne scars. And you know, acne scars happens to be a specialty of mine.
That's right.
Now, they were using, I think, a 0.5 millimeter needling, and the problem, they say that they got some improvement, but the problem with acne scars is that acne scars go down between 2 and 2.5 millimeters. So if you're going to use an at-home roller that's 0.25 or 0.5. I really don't recommend the 0.5s to be used at home unless you're really careful about it and there's a lot more risk. Then you're really not going to be treating acne scars that well. So my assessment in the long run is that the at-home skin roller does a good job for giving you skin rejuvenation when it's added with either retinol or some topical cosmeceuticals.
Okay.
I don't believe the at-home roller, unless you buy one that has the potential for a huge amount of side effects, is particularly good for acne scarring. I think that if you want to start treating acne scarring, we have to go to the other device, the DermaPen device that I was telling you about that we do in the office, where we can set it to 2 or 2.5 millimeters. We can get it to repeat itself more often, and we can penetrate deeper into the dermis and get a much more sophisticated and robust response. Although I must say that there is some bleeding afterwards, and it stays red for a little bit longer, but the response with acne scars with the deeper needling seems to be very good. Now, I want to point out that there are some tricks that we use in the office to make the needling even more effective. One of the new tricks that we do is we will add PRP, platelet-rich plasma, which you asked me about. Now, platelet-rich plasma is blood that is drawn and spun down, and the clear portion of the blood is plasma that is rich in platelets. And we feel that there are a lot of growth factors in that plasma, and there are a lot of good things. Now,
so just, Dr. Rapaport, just this platelet-rich plasma, now this is taken from the individual. This isn't something that's brought in to the office. Is this something that's harvested from the individual? Because that explanation of the dermal rollers, the difference between the home use rollers and the professional derma pen method that you're using in the practice, obviously you can go deeper, and obviously it's in a controlled environment. But now this addition to the PRP, the platelet-rich plasma, is something that I believe is an adjunct and enhances this whole procedure that can't be done at home. But if you could just start with, is that harvested from the individual, or is that a similar product?
You would come in, we draw the blood, it's a special tube, it's put in a centrifuge, the blood is spun, and we harvest out the clear portion, which is the plasma, and then that plasma is rich in platelets, and that is what we use both topically and for injections in the office. Correct. Right. Now, that platelet-rich plasma is exceptionally good at getting the skin to heal and to rejuvenate. So what we will do is we will combine the platelet-rich plasma with an aggressive needling. An aggressive needling for acne scars is usually 2 to 2.5 millimeters, and an aggressive needling for skin rejuvenation is 0.5 to 0.75 millimeters. And what we do is we actually put it in a syringe and drop it onto the skin, and we let it soak in and penetrate. And the healing time from the needling decreases, in my estimation, anywhere between 20 and 30%. So you will respond, if you do an aggressive needling, you will get a much quicker healing rate, and we think that it also stimulates some collagen production as well as rejuvenation. Mm-hmm. So in that way, we use a combination of the needling and the PRP. I don't think PRP can be done at home, although these days people are doing everything at home. But if you have a centrifuge and you're able to draw your own blood, but I really don't recommend that. But that's how we're using the needling with the DermaPen, with the multiple punctures to the different depths that I told you. Right. There just happened to be a very important article uh, on treating atrophic acne scars with a laser, which the CO2 laser, which also puts these channels into the skin. And they reported that when they combined a product called Sculptra, which we talked about in the past, which stimulates the body to perform collagen production, that they got a very nice healing of depressed acne scars by using the CO2 laser and the Sculptra. What we are using in our office, if the CO2 laser is not appropriate, we are using it with the CO2 laser for the more difficult cases, is either instead of PRP, we're combining Sculptra with the needling, and we seem to be getting some very good results with that also. So that's hot off the presses. I have a feeling that for bad acne scars, the better way to go is with the CO2 plus the Sculptra, but for people that want rejuvenation, or let's say around the in certain areas where they have thin skin, we will use the needling plus the Sculptra.
Right.
So we have our options as to, there's a myriad of options as to what you're going to do after you do the needling. What are you going to put on the skin? And nobody has really scientifically researched as to what is the best thing to put on for each indication. And the reason that no one has really done that, because there's no drug company or pharmaceutical institution that plans on doing this, because there's really not very much money to be made in it, so they're not going to be doing the research. So most of this is being done ad hoc by dermatologists and reporting them in the literature.
Right. Now, I down here in Miami where I live, I saw on television on the news not so long ago of Kim Kardashian was down here, and there was a whole story of her on the television, and she'd had what they called a vampire facelift, which sounds similar to this needling in the PRP. Is a vampire facelift, which I've actually seen in some other trade journals as well. Is that the same thing that we're talking about here?
Okay. I don't exactly know what they mean by the vampire facelift, but I think I have a good idea. I think the vampire facelift is a trademark name, so I don't want to tread on it too heavily, but I can tell you that a couple things. Number one, after we do the needling, we use the PRP topically, and we usually do 2 or 3 applications. We also take the remaining PRP and inject it into the skin, because it also, under the skin, will stimulate different things and stimulate rejuvenation. And I know that Kim Kardashian, I don't know, but I assume that she's a little bit young to have a regular facelift. So I'm assuming that when they talk about the vampire facelift, they're talking about needling of the skin, topical PRP, and then injecting PRP into the remainder of the face in order to give it rejuvenation and to hopefully plump up certain areas.
Right. Yeah, I mean, I saw that when I saw the picture, it was just like a whole bloody face sort of type of look.
Well, the bloody face is from the needling. Okay, the PRP should help decrease that pretty quickly. We also add something called gentle waves, which decreases redness. We've talked about that before. And then we'll go and we will inject the PRP into the different areas of the face to get the skin rejuvenation and to get some firmness. Now, I want to let you know that almost all of these procedures are not FDA approved in terms of they're mainly investigational type procedures. You're not going to see a huge number, and I haven't seen a huge number of articles on this. I just came back from 2 meetings, and most of the American presenters were not even dealing with this. It was mainly people, as I said, from England and Europe, as well as Brazil and Korea. So I think the American aesthetic doctors, such as dermatologists such as myself and plastic surgeons, have been very slow to adapt PRP for rejuvenation. However, PRP is widely used by the orthopedists to correct various orthopedic injuries, especially injections into joints and into other areas where they're looking for the areas to heal quickly and to try, for instance, with different knees or elbows, etc., to get the body to heal itself. So we have been pretty active in the orthopedic area. We have not really been very active in the cosmetic arena.
Let me just to avoid any confusion, because I've worked with some doctors that talk about stem cells and this platelet-rich plasma. The platelet-rich plasma is not stem cells, is it?
No, it is not. Platelet-rich plasma. Platelet-rich plasma is not stem cells. Stem cells is a embryologic type cell that can change itself into what it needs to change itself into. So platelet-rich plasma is mainly the way I would describe it is a very high concentration of growth and rejuvenation factors. It's not stem cells.
Right. So your natural growth factors, which help in the repair.
And Craig, it's from you. I had a patient that came in, and it was a husband and wife, and the wife wanted to know if she could use any leftover of the husband's platelet-rich plasma. And everybody's platelet-rich plasma has to be drawn and has to be harvested from themselves.
Right, so you can't go bottling it yourself and selling it to other people.
No.
Let's just ask this question. I'm interested in who would have this type of treatment, the needling with the PRP. Now, I've heard of people with acne scar as obviously people coming in to have a consultation with you, depending on the severity, depending on the type of scarring, as we've discussed before, you will select the style of treatment or combination of treatments relevant to their particular issues. But when just elaborate on specifically who would be a good candidate for this treatment, both for acne scar and facial rejuvenation, the type of candidate or age group, or out of all the prospective patients you see, who would be good candidates for this type of treatment?
Okay. You know that, and we've talked about this many times, that when you have acne scar patients, you have to divide the acne scar patients based upon the type of scars that they've had.
Yeah.
In the past, we've talked about treating acne pits. And I was probably one of the first dermatologists in this country to adopt a Korean technique called the CROSS, chemical restructuring of acne scars, where we would put TCA acid into deep pits. And the whole purpose of putting the TCA acid in the deep pits was to get the deep pit to fill in from the base of the pit, and after multiple sessions, the pit would fill in. Now that I have a dermapen that can go 2.5 millimeters into the skin, I can now go down on pits with the dermapen and take off the epidermis, which is what the TCA does. We have to, if you don't take off the top layer of the skin, you're never going to fill it in from deep. We go in, we stretch the skin, we take off the top level of the epidermis on pits. Now, pits is probably the most difficult of all the acne scar lesions to treat, because unless you're going to cut them out, and if they cut them out, I'm really not crazy about cutting them out, because you're taking one type of scar and making another type of scar, and there's too much, the risk-benefit ratio isn't there. So what I'm doing now, instead of doing the cross technique on the pits, what I'm doing is a deep needling and combining it either with PRP or something else to make it heal from the inside out. And we've been getting excellent results in a much shorter number of treatments than we used to have to do with the cross technique. So if you ask me what type of acne scar I think works best with the needling and the PRP, it is the acne scar pits. So when people come in and ask for treatments, we treat everything else with the normal way we usually do with the lasers, but when they have the pits, we will go and use the needling and use the needling to get the deep pits treated.
Okay.
Now, as far as skin rejuvenation, it's really good skincare, so there really isn't anybody who would not be a candidate. The only problem that you have to be concerned about, well, one of the problems that you have to be concerned about, there's always problems, but you try to control your variables. But one of the things that we are concerned about when we use the needling is in darker skinned individuals, there's always a risk for hyperpigmentation, turning darker after the treatment. Remember, anytime that you inflame the skin with a darker skinned individual, you have a risk of it turning dark. So what we do is we pre-treat our darker skinned individuals with bleaching cream for 1 or 2 weeks prior to the needling procedure, and then afterwards we tell them to use the bleaching cream also so that we don't get the hyperpigmentation.
Okay. So what I'm trying to understand here in terms of, I've just come back from a trade show, a medical spa trade show, and you see obviously tons of different methods to rejuvenate the face. Right. And obviously acne is a particular problem that people are looking for solutions for, which we've covered. But the facial rejuvenation market, people wanting to look 10 years younger in 10 minutes.
Okay, let me tell you that
everybody's looking for that immediate gratification.
Okay.
Where does this particular application fit in to that group of people who are looking to look younger facially? Please explain what they would notice on their face. Are we talking years younger? I'm just trying to understand what results they would expect to see, or their expectations.
Okay, I'm going to make a pretty bold statement. You're going to see a cataclysmic shift in the way people are treating their faces for skin rejuvenation, and I'm going to tell you why. If you believe that the topical cosmeceuticals work, and we know that retinol works, and there may be a couple other ones that work, the problem is penetrating the skin barrier, okay? So if you're putting on your moisturizing cream, your skin rejuvenating cream, whatever you're putting on, and you keep putting it on, you're getting 97% of it blocked at the skin surface. So it really is not getting down to the areas where it's going to really work.
Okay.
Now, you take a skin roller and you roll the face gently before putting on any one of these skin rejuvenating moisturizers or serums or whatever it is, and there will be specific serums, and I'm working on specific serums to go along with the rollers, and you have an absorption that is 10 to 20 times higher than if you didn't use the roller. Okay. So in the future, I think what you're going to see is that almost all skin rejuvenation products that are for real and cosmeceutical products that are for real are going to be combined with some sort of skin needling or perforating the skin, because you're going to get a higher concentration of the medication in the skin.
Right.
And that is going to be a complete change. When you take something that's mildly effective and you create a channel so it can go in, it becomes significantly more effective. So you're going to see the effectiveness of over-the-counter cosmeceuticals to go up tremendously once they're combined with skin needling. And I think within the next 5 years to 10 years, that is going to be the change that you're going to see. There's going to be revisions in the formulations on the cosmeceuticals, and there's going to be revisions in the way that they're delivered so that they can get past the skin epidermal barrier.
Right, so I've already seen, I'm from Europe, a British accent, so I'm from Europe. I've seen quite a number of these packaged items for consumer use, sold on the internet. sold in practices to take home. It sounds like you will eventually have an in-home.
I have it in my office, yes.
Right, so you have like an in-home regime program that people can use at home. I'm trying to identify here, in addition to that, the candidate that would come in to see you. How fast are they going to see results? Do you have any? You're going to look X amount of years younger. This whole facial rejuvenation market is obviously a huge market. People wanting to look younger, but surely there's a difference between the results you can achieve in your practice to what you're going to achieve at home.
Exactly
yeah,
right.
Please just explain what people's expectations would be coming in to see you.
There's a couple major differences that you're going to see. Number one, people that have weathered skin and that have what we call actinic damage, that have multiple wrinkles on their faces, you're not going to get rid of those with needling plus a good cosmeceutical, because those areas have to be vaporized with the laser. Those areas have to be contracted with the laser. You're not anything that needs to be where the skin needs to be removed or the skin needs to be tightened is not going to be able to be performed with needling plus a cosmeceutical.
Okay.
If you have someone who has fairly smooth skin and wants to beef up and make it a little bit firmer, wants their skin to, their pores to look better, those are possible by using the needling plus the PRP. It's not going to take someone who has ravaged acne scars and take their acne scars and make their acne scars go away. Over time, maybe 6 to 12 months, they may get some slight improvement. But when you're talking about people that have more severe photo damage,
Hello, Dr. Rapaport. It's like I might have lost you. Can you hear me? Hello? Dr. Rapaport? Hello? It looks like you're frozen. I'm good at this end. I think we're still live, but looks like you've frozen at your end. I can't hear you. I'm not sure whether Dr. Rapaport is going to manage. No, I think we've maybe lost Dr. Rapaport. Not quite sure what's happened, but certainly we've got a lot of great content in there today. Looks like for exactly those people. I was going to ask what age group, but it seems like I'm like my mid-40s. It sounds like people my age, 30s plus, not the deep wrinkles. I mean, I've not got totally wrinkled yet, but I think I would benefit from this procedure in practice. Now, I was going to ask Dr. Rapaport the costs involved in these types of treatments. That was going to be my last question. What sort of cost is involved? Which I'm sure probably the best thing to do is, and I'm not sure whether Dr. Rapaport's back on now. Hello, Dr. Rapaport, I think you're back on with us.
yeah.
Okay, yes, you're back on now. I was just ad-libbing for a while and just wondering technically that we'd lost you for a bit. Yeah, not sure what happened technically there, but we've got you back on now. So yeah, I mean, just to finalize that last question is really just relating to the age group. I was just like mentioning while we just lost you that I mean, I'm in my mid-40s. What sort of age group of people are going to be having this type of treatment in practice? 30s, 40s?
I think in practice, 20s, 30s, 40s. I think once you start getting to 50, 60, and 70, that you're going to go to the more aggressive treatments that are done in the office.
Yeah, that makes sense.
It also, you know, a lot of this is based upon sun exposure. And people who have a lot of sun damage have increased aging, and they have increased what what we call solar elastosis. If you look at these people, they have crepey skin. The solar elastosis and crepey skin can be seen in people in their 50s if they've spent a lot of time outside. So the more severe cases are going to end up being treated with more aggressive lasers. The people who have fairly decent skin and want to just improve on their skin can do so very well with the needling plus the skin rejuvenating topical cosmeceuticals or PRP.
So my last question would be, and that would be the sort of cost involved. What would be the cost involved on having, is this a series of treatments, a whole program? What sort of costs are involved in somebody who is looking for facial rejuvenation? Acne.
I want to go over one other thing which we haven't meant, which will probably knock your socks off. And this,
okay.
And this is really not extensively studied, but I've seen it in my office. Another use for needling and PRP is hair growth. And we have seen the most obvious one is people who use needling and combine it with the Rogaine or minoxidil, because the minoxidil penetrates better and they get better results with their Rogaine if they use the needling prior to using that. On top of that, we recommend, in addition to the needling and the Rogaine, we have seen that people who inject PRP into their scalp, we are growing hair. It's amazing, but we are growing hair by injecting PRP into people's scalps. We still have them use the topical Rogaine. If they want to be aggressive, they can use it with a roller. But just the injection of the PRP with the Rogaine, we are starting to see hair growth that is definitive. We're taking pictures. We have patients that are very, very satisfied. We have about 7 patients now, both male and female, that we're doing. And if this pans out to the extent that I think it will pan out, it's going to be a major advance for people who are losing their hair.
Oh, now this is an interesting topic for me. If I just bet you look at my hairline,
right?
I'm losing my hair. Are we talking about I'm a good candidate to fill in these areas here, or is this so that I should have been doing it 20 years ago when I first recognized my hair falling out? Can we fill in these areas? Is this what? Please just qualify.
All right, I'm going to give you a qualified answer. Once the follicles are dead, the follicles are dead. Okay, so when you have a very shiny area with no follicles and no hairs coming out, those follicles are dead. But if you have areas where your hair is thin and the follicles are still open and alive, those are the follicles that we can rejuvenate with the PRP and the needling. So we'll do needling, we'll put on some PRP, and then we'll inject the PRP, and if it's not an area that is totally shiny, we are seeing results. Now, I'm also working on some of the areas that are totally shiny, trying to get that, but as of right now, I don't really see as much response, if any response, in the shiny areas as I do in the areas that have the follicles that are alive.
Okay, so those losing their hair, catch it early and do something preventative.
Yes.
Right.
And
excellent.
as I keep studying on this, in my office, eventually we're going to end up doing another hangout strictly on regrowing hair using PRP and minoxidil and needling.
Well, that's what we should do. Get some before and after pictures.
We are taking before and after pictures on everybody.
Right. So we will definitely do a hangout specifically
but I'm
just
on that topic. I'm giving you an early heads up.
Right. Excellent. Sounds good. So down to cost. Is this a program, a series of treatments? Does it depend on the individual?
If someone's coming in for, and we are doing a lot for the hair loss, we charge $300 for the PRP injections, just the injections alone for the hair loss, and they're being done at once a month for 4 months, and it's for $300. If you want the PRP plus the needling, then we charge an additional $200. It's $500. if you want to come in for PRP plus skin rejuvenation, it's anywhere from $500 to $600, depending upon how many areas we have to do. And now, I do not think that you need to do 4 sessions with PRP and needling for skin rejuvenation. I think because the needling that I do is significantly more aggressive, I usually say that it's usually 2 to 3 sessions.
Right. So just on the subject of facial rejuvenation, I'm just interested. You know, I could do with some facial rejuvenation. I'm mid-40s, so I'd be a great candidate for facial rejuvenation using the needling with the PRP.
Right.
So I would be probably coming for 2 or 3, or you say like 3 sessions.
Right. It'll run.
What would the result? What would be the expected? Am I going to look younger? How different would I look?
First of all, you'll have a glow to your skin. Not everybody. Nothing is guaranteed in cosmetic procedures. So, what I'm saying is something that we see in most people. It doesn't happen in 100% of the people. Okay, but you're going to see that your pores are better. Your skin feels firmer. Your wrinkles are effaced, meaning that your wrinkles aren't as deep, and that your complexion tone is going to look better. That's a combination of a lot of different things.
Well, I can honestly say I'd like your regime, because whenever I do these hangouts with you, you're a doctor. You have all your hair, your skin looks great. You look like it's constant even tone. I'd love to have your skin, whatever you're doing.
Well, I do all these things, you know. I try them out on myself too.
Right, I bet. So, do you have anything else to add to this particular hangout, Dr. Rapaport, before we close off?
Well, I want to add that this is just the beginning of the PRP needling, skin penetration, combination therapy era, and it's going to. This is the area that is going to explode in terms of both physician office and cosmeceutical industry future. And I've given you some basics. This is changing as we speak, and it's constantly being updated. I'm actually working on a skincare line that's going to be combined with a roller, with a celebrity. There's a lot of different things that are going to be coming along in the future that are going to be based upon skin needling. And initially I had some doubts about the skin needling, but I have to tell you now that I'm definitely a believer. And I also want to tell you that your listeners have to be careful, because unless they properly sanitize the roller, an at-home roller, or if they use one that's very deep and they start getting bleeding, or they use one too aggressively, they can adversely affect the texture of the skin and cause more damage than what they started with.
Right.
So I want people to understand that it's good, but more is not better.
Right. Well, it sounds like to me what I'd be suggesting to people is make sure you come in for an in-office visit. We've just lost I think with that disconnect there, we lost our website down there at the bottom, but Cosmetic Skin throughout the whole of this Google Hangout, and certainly on the website that you'll see this, cosmeticskin.com, my suggestion would be speak with Dr. Rapaport's staff, go in for a consultation, have something professionally done first, and I'm sure then Dr. Rapaport, if there is an in-home regime, would either supply you with the in-home regime or at least advise you the best way of going about doing this treatment at home in addition to in the office. I think that would be fair to say, wouldn't it?
I think that's a great summary, yes.
Yeah. Excellent. Well, again, thank you, Dr. Rapaport. Everybody who's listening, give Dr. Rapaport's office a call at cosmeticskin.com, and the telephone numbers that you'll see around this page when you see this this particular Google Hangout. Otherwise, again, thank you for your time, and until next time, we'll see you soon.
Okay, Craig, enjoy the summer, and we'll have to do this again soon.
Excellent. Thank you very much.
Take care.
Bye.
Bye-bye.